Hello, my name is Cihat ÇELEBİ. I am a health specialist and a physiotherapist in traditional and complementary medicine department, Turkey. Pardon. My conversation outline is the legal background of the traditional complementary medicine in Turkey, institutional structure, international cooperation, Turkey's potential about traditional and complementary medicine, and evaluation. The Turkey government passed the regulation on traditional and complementary medicine practice on October 27, 2014. This by law entitled the Ministry of Health to regulate and monitor all activities at national levels at the sole authority. In this paper, the regulation on clinical research and traditional complementary medicine practices published on 2019. The objective this regulation is to regulate procedures and principles with regard to doing scientific research on human beings in the field of traditional and complementary medicine practices and voluntary rights. What is the institution of traditional complementary medicine in Turkey? We have three branches in our hospital and health infrastructure: practice center, training center, and units. The practice centers indicates the center established under the responsibility of a physician or a dentist, corresponding with certification. Within the health practice and research centers of a training and research hospital and the Faculty of Medicine and Faculty of Dentistry, in order to perform the practice specified in this regulation and provide training upon the authorization by the ministry. In this regulation, we have 15 applications in the slide. We have three types of practice center sectoral breakdown: Ministry of Health, Education and Training Hospitals, State University, and private university. Total number of practice centers are 78. Training centers authorized by the ministry to provide training under the regulation on certification program. We have 26 training centers. Over the 50% is established under Ministry of Health training hospitals. And we have 1,464 units established under the responsibility of a physician and or dentist certificate within the healthcare institution owned by public and private legal persons and by natural persons in order to perform the practice specified in the regulation. We have state hospitals, but in the province, little hospitals, and private hospitals, medical centers, and doctor's office, for example, the units. We have breakdown of the TCM units regularly, or doctor's office percentage is 64, and others in the slide. We have, I said before, we have 15 training certification program. Currently, we authorize it 176 apitherapy certification. Universal health coverage in Turkey. We have 78 practice centers and 1,464 units. Public and private hospitals, branch centers, medical centers, polyclinics, and doctor's office is made accessibility for TCM applications. Evidence-based practitioners certification licensed by Ministry of Health. Regular controls to TCM centers by Ministry of Health. And we are in this, we are not reimbursement for traditional complementary medicine application. Universal health coverage means usage of full spectrum essential quality health services from health promotion to prevention, treatment, rehabilitation, and palliative care by all without having financial hardship. Healthcare services in Turkey is in line with cost-efficient approach, but TCM activities not including in national health system by reimbursement perspective. We have a lot of international cooperation with World Health Organization, European Union, Islamic EOC, Islamic countries, by Islamic countries, and Asia and Arabic countries, attaching utmost importance to traditional and complementary medicine cooperation at bilateral and multilateral levels. We are active participation in the work of international platforms. Advocacy. The strategy of WHO traditional medicine strategy aims to support member states is developing proactive policies and implementing action that will strengthen the role traditional medicine plays in keeping population healthy. This strategy more attention to prioritizing health services and systems, including traditional and complementary medicine products, practice, and practitioners. The global report on traditional complementary was published on 2019, and Turkey was participate this program before. This report reviews global progress in TCM over the past 2 decades and based on contributes from 179 WHO member states. And Cambrella project is very big and interesting project about traditional complementary medicine. Is the research web working on traditional and alternative medicine practice in European countries. Project duration was started on January 2010. 16 different research institutes in 12 European countries was participated, but Turkey at that time we have not another infrastructure or facility for traditional complementary medicine by under the Ministry of Health, so that we couldn't participate this project. High-level coordination. International Tradition and Complementary Medicine Congress takes place annually in Istanbul by cooperation with WHO organization and presidency advocate, bringing international efforts together in order to open road for evidence-based implementing of TCM. Turkey has very big and very interesting potential for traditional complementary medicine. We have rich cultural accumulation, unique flora, and strong political commitment, and the very big practitioner and practice workforce. A history of Turkey of thousands of years for traditional folk medicine. Application of traditional healing practices containing traces of faiths and belief of past Anatolian civilization, having been executed by shamans and camps in the ancient times. Traditional practices have been maintained by religion men, wives, folk healers, and ojaks in Islam and cultural around. In Turkey, we have 4,700 endemic plants, which can be increased to 12,000 with a good agricultural practice. In these endemic plants, 500 of the endemic plants are medicinal and aromatic plants. So we have unique and big flora. Evaluation. Traditional and complementary medicine is an indisciplinable part of health. However, it is not an alternative to modern medicine. It is integrative, not alternative. Integration of traditional and complementary medicine practices to modern medical practice is vital in order to improve the quality of life of our society. WHO should continue playing a key role on developing norms and principles in these fields. Let's start apitherapy. We have, I said before, we have traditional and complementary medicine regulation. At this context, the second of the application listed in Annex 3 is apitherapy. Apitherapy, it is the use of B and B products as complementary and supportive in the treatment of some disease. But bee venom, honeybee apples containing extract containing bee venom, ointments containing bee venom should be used. In our country, only certified physicians are authorized to practice. Only medical doctors, dentists, pharmacists, other health personnel, or not health workers cannot apply this application. Currently, we have about 163 doctors, medical doctors, with apitherapy practice certificate. Apitherapy is used as a supportive method in the following application and areas that may be related. No statement can be made that it will eliminate the disease or treat an alarm. In units, private hospitals, state hospitals, and other medical doctor office, etc., honey, pollen, propolis, and royal jelly can be used to support the immune system in secondary immunodeficiency. But in university hospitals and traditional and training and research hospitals, we can use bee venom, honey, and musculoskeletal system to reduce symptoms such as pain, redness, tenderness, and other muscle weakness. If there is an allergy to bee and bee products and children, bee venom under the age of 18 and other the product under the age of 1, apitherapy cannot be applied in this situation. Bee venom, it cannot be applied to decompensate hair failure, kidney failure, respiratory failure, systemic local infections, liver dysfunction, and beta blocker use. We should be kept with devices products, for example, live bee, bee venoms, dressing set, lysoch, autoclave, and nebule for allergic situation. Certified trainings are carried out in 2014. Apitherapy's certified training standard entered into the force in 2016. The aim of the training program is to provide the physicians who will perform apitherapy with the competencies that will enable them to perform this practice effectively and efficiently. The training are given theoretically and practically by authorized training centers and by competent trainers. 80-hour trainings is 2-branch, 45 hours of theory and 35 hours of practice over the less people. I can't tell about apitherapy products before because in our country the licensing of apitherapy products is carried out by the Turkish Medicines and Medical Devices Agency. It is related free and under the Ministry of Health infrastructure. And apitherapy products cannot use for the medicine. These products are licensed by Ministry of Stock and Forestry. Apitherapy application centers numbers are 8. We have 15 units application number authorized by the Ministry of Health on apitherapy. We have a strong political commitment. International Traditional and Complementary Medicine Congress has been held under the auspice of the Presidency of the Republic of Turkey. And official release of WHO Global Report on Traditional and Complementary Medicine in 2019. We have Traditional and Complementary Medicine English webpage, and we have in this page announcement, organization, legislation, and another part of the website. Thank you for all. If you want to, thank you for kind attention. My telephone number and email address is here. Thank you again, and sincerely.